U.S. News and World Report does ratings of hospitals. They evaluate hospitals on their performance, and they just recently announced that Parkland Health Center has been named a high-performing hospital for maternity care. So some of the things that they evaluate, such as when we talk about C-sections, it's very important that we try to not do a C-section if unnecessary. So we want to make sure that we bring in our mothers at the right time. So no early deliveries. We actually have a cutoff time that we will not bring a mother in early unless there's a need from a medical perspective. So that's one of the things we're evaluating on. And then that leads to our C-section rate, and we actually are evaluating on what's called primary C-section rate. So meaning first time. How often does a first time C-section occur? And we score very well compared to other hospitals in that the percentage of times that happens here. So that's some of the things that they are measuring. Some of the things they also look at is you mentioned breastfeeding. So we also look at when a mother would desire to breastfeed, how well do we do at helping them to be able to do that? And we have a pretty high score, and being able to make sure that when they desire to do so, that they're able to do. And one of the things we've actually done this year to help with that is all of our nurses have recently become certified as certified lactation consultants. So they're even more skilled at being able to guide a mother through that process, which is very important because it does, as a new mother, it takes time, it takes patience to be able to make sure that they and the baby connect well with the breastfeeding process. We know through research that when a mother and a baby actually receives breast milk, it's healthier for the baby. There's antibodies that they receive through the mother's milk that helps them to ward off illnesses. It's just all around better for the baby from a nutrition as long as it works well. So that's one of the things that we measure on as well. Another thing that we also measure on, and actually this is something we've received a different type of award on, is how do we teach our mothers about safe sleep for our babies. So there are specific ways that we recommend that a mother or the family handles a baby and has the baby sleep that makes sure for safe sleep. And by that we mean we know of sudden infant death syndrome. We don't want that to occur. So using those safe sleep practices are the best for the baby. So we actually recently also received an award for being a safe sleep hospital. So we actually participate in many process improvements across the state and across our BJC family as well. So the state of Missouri does different process improvements, and we work with them, and we always do very well with the initiatives that they recommend. Recently, they actually did a pilot on offering high-risk women for preeclampsia to receive a blood pressure cuff into their home. That way that when they're able to monitor themselves, and if their blood pressure begins to get up, they can actually be seen by their OB in their OB office prior to it getting to the point of needing hospitalization, which is really an important part of it. So after that pilot study actually stopped by the state, our hospital foundation is now funding for us to continue that process because we learned it was a very good process. So our foundation actually helps us to buy the blood pressure cuffs that when our physicians identify a mother as high risk, that we are giving that blood pressure cuff to them to be able to use in their home and to be able to make sure that they're monitoring their blood pressure and able to get to see our physicians as soon as possible when they have starting to receive that elevating blood pressure. And that's ways we can actually keep the baby and the mother healthier and reduce risk for complications. So that's a part of that evaluation that came with the U.S. News and World Report is our low complication rate. So we all know as we look at statistics across the United States, Missouri actually has a fairly high maternal death rate, and we do very well with that. That's not a complication that we experience here. Now we are fortunate that when we have a high-risk mother, we're able to work with our other BJC facilities and have them being seen by a specialist. So our maternal fetal neonatal specialists within BJC are able to assist our local physicians. So we have that great relationship that we're taking care of the most amount of women that we can in the best way we can, but when we recognize there's something more than what's really safe in our facility, then we're able to work with those our sister facilities, our collaborative facilities. So we actually have that wonderful advantage. The other thing we also have a great advantage of from a complication perspective is because of our relationship with St. Louis Children's, when we do have something that is a concern with a baby and we want them to be taken to a NICU, then our St. Louis Children's partners can actually bring the helicopter with a special crew, special bassinet thing, and take them up by helicopter up to where the specialists are able to take care of them. So again, we have that special relationship, so we can truly care for most situations, but when it just gets that little bit too much for a local care to happen, we've got those partnerships, and so that's really part of helping us to ensure that complications don't happen. We're able to stop them and get them taken care of soon.